Hello, you're watching Health Day Now. I'm Mabel Jung. The American Diabetes Association's 2021 conference has concluded. This year, the meeting was held virtually. In particular focus was the pandemic and the many ways it affected people with diabetes and healthcare delivery. More than in the past, speakers addressed ethnic and racial disparities in the delivery of care. And there was a tribute to the 100th anniversary of the discovery of insulin. For details and other highlights from the meeting of the American Diabetes Association, I'm so pleased to have Dr. Robert Gabbay, Chief Scientific and Medical Officer with the ADA. Dr. Gabbay, thank you so much for your time today.
Well, thank you for having me here.
Can you compare for me the risk factors for those diabetes patients that have been vaccinated versus those that have not been vaccinated?
Well, what's emerging now is that most all the continued deaths related to COVID are in unvaccinated individuals.
Mhm.
And so, honestly, I can't say this strongly enough. If you have diabetes, get vaccinated. Speak to your healthcare provider, discuss your concerns. But with the risk of hospitalization and death related to COVID being 6 to 12 times higher in people with diabetes, it's time to get vaccinated.
Okay. Now, since we're on COVID, a statistic was shared by the ADA CEO. 40% of Americans who died from COVID-19 had diabetes, especially staggering when you consider that only 10% of the US population suffers from the condition. How did COVID add another difficult layer to diabetes management, and what will that mean for the future?
Well, the pandemic disproportionately impacted people living with diabetes, and that statistic of 40% of all the deaths in the
Mhm,
U.S. for related diabetes is really quite sobering.
mhm,
Uh, it has also highlighted uh, some age-old problems, and one of those is really around health disparities. So within that group of individuals that died from COVID, uh, Black Americans were significantly higher risk of poor outcomes from COVID compared to white individuals. And so really a big issue that the American Diabetes Association has taken a strong stand on and developed a platform called Health Equity Now, which includes a patient bill of rights that says things like everyone with diabetes should have access to healthy food. Everyone with diabetes should have access to the treatments that can help them live better lives. And so, really an important area for us to focus on.
We're looking at an obesity epidemic, making more people at risk for diabetes. What is behind this, and what messaging can work to better advise patients on their lifestyle choices?
Obesity is rising and it is fueling the diabetes pandemic. Uh, what can we do about it? It's multifactorial, but I would say some things that are clear. Uh, Access to healthy food is an important issue, and there are in this country food deserts and food swamps where even if you want to do the right thing, the right foods are not available. So eating more healthy foods clearly is part of this. Uh, and increasing physical activity, critically important. And that is not always available for everybody in a safe place. So that's another important area. I think for clinicians, as we talk to our patients, uh, there, I think there's a little bit of a shift that we need to slowly move towards, and that is as opposed to lecturing on all the things that people need to do, asking them, what do you think you could do to improve your health?
Mm.
Um, and let them come up with some of the solutions because they know the context they live in. And those might be great solutions, or maybe they're not helpful things, and that allows the provider to engage. But too often we get into a lecture mode, and I'm not sure that's always helpful.
Right.
Sometimes it is, but I'm not sure that always is.
Yeah, yeah. I can imagine that people are tired of being nagged about what they're not doing or what they should be doing.
Yes, right.
Mm,
People know that they should probably exercise more,
mhm,
um, and just telling them that is probably not so effective.
mhm.
Asking them, what could you do to exercise more? And then once they present a solution, work with them to, create a smart goal to,
Yeah,
when will you do it? How will you do it, et cetera, and help them problem solve.
right.
Likely to be far more effective.
Yeah. Now, this year marks the 100th anniversary of the discovery of insulin. Huge, really huge. But the reality is that many people can't afford it. What is the American Diabetes Association doing about that?
Access to insulin is critically important. And here we are 100 years after this discovery, and that we're still challenged by this. And again, the pandemic has made this worse. We surveyed and identified that a number of individuals had less access to medication than they did prior to the pandemic. Um, One of the things that the American Diabetes Association has been doing to advocate on this issue has been working state by state to pass legislation. We've now done it in 19 states to limit the overall cost of insulin for many individuals in those states. So we're continuing to advocate in all the other states to make sure that everybody who needs insulin can get the insulin they need.
Okay, Dr. Robert Gabbay, Chief Scientific and Medical Officer with the American Diabetes Association. Thank you so much.
Thank you.
And you've been watching Health Day Now. I'm Mabel Jung.